I include this next study just because, again, we continue to try to make improvements in how we treat patients. And so in this study, which we call the SHINE study, it attempted to add a oral medication to bendamustine and rituximab to see if that can improve outcomes in patients who are unfit for an autologous stem cell transplantation. So patients were randomized to 2 arms. They got bendamustine and rituximab alone. And then for the second arm, they got bendamustine, rituximab, and this oral medication called Ibrutinib, and which we will refer to as Ibrutinib tyrosine kinase inhibitor, and we will discuss a bit more in some of the later slides. So in this study, all patients receive 6 cycles of treatment, which means you get treated with that regimen 6 times. Thereafter, patients then went on to receive rituximab as a maintenance therapy, meaning you get it every 8 weeks. So pretty much every 2 months for about 2 years. And in the arm that included the experimental drug Ibrutinib, they continued that medication until progression of their cancer or intolerance. So the 2 things to take away from this study is that the PFS, again, progression-free survival, was improved by the addition of this oral medication to bendamustine and rituximab. So patients, again, cancer stayed in remission longer. But if you look at the slide on the right, there is more toxicity with this experimental arm than what we saw in the standard of care arm, suggesting that in that situation, again, even though we did get a PFS benefit, again, time where the cancer is in remission, that was sort of circumvented by toxicity that impacted the survival of patients on this arm. Taking this into account and the fact that we do know with that oral medication, it can be given after bendamustine and rituximab, and we can probably as well get the same amount of time as far as the progression-free survival. This study has not necessarily been what we consider practice changing, and it's not necessarily something that we recommend for majority of our patients in the frontline setting with mantle cell lymphoma who are not fit for a more intensive therapy. So again, this oral medication, as we discussed later, is important, but it is not necessarily something that adds substantial benefit without toxicity in the frontline setting, meaning to newly diagnosed patients.